All right, hello everyone, and welcome to Kaiser Permanente's Ambulatory Surgery Center here at Tyson's Corner, Virginia. My name is Dr. Chen. I'm a practicing anesthesiologist, fellowship trained in regional anesthesia. Today we are excited to highlight and explain what nerve blocks are and how they can play an important role for patients undergoing surgery. If you are having surgery, ask your surgeon or anesthesiologist whether you are eligible for a nerve block. It'll depend on the type of surgery you're having, your overall health, and several other factors. I'm joined today by my excellent colleagues, Drs. Abrahm Behnam and Dr. Rambhia. I'll have them introduce themselves and then we'll get started. Dr. Behnam.
Hi, my name is Dr. Abrahm Behnam. I'm also an anesthesiologist fellowship trained in regional anesthesia, primarily practicing out of the Maryland.
I'm a practicing anesthesiologist, also fellowship trained in regional anesthesia, and I practice with our Northern Virginia group based here in Tyson's Corner. We're really excited to talk to you all about the benefits of regional anesthesia and what nerve blocks can do for you. But before we get started, we did want to clear up some of the terminology that we'll be using today. So for today's purposes, when we refer to a nerve block, we're referring to regional anesthesia. And what that means is the practice of numbing up specific parts of the body in order to facilitate pain control both during and after surgery. So just like when you go to the dentist and have your teeth numbed up before a cavity is filled, we are able to numb up specific parts of your body to really help with pain control, again, both during and after surgery. When we refer to general anesthesia, that's typically what patients envision as the mask over your face and drifting off to sleep and being completely asleep during surgery. Now, regional anesthesia and general anesthesia are not mutually exclusive, so you actually may undergo both types of anesthesia for your surgery depending on what is necessary.
Great, thank you for that explanation. Okay, so Dr. Behnam, let's get started with the basics. What is a nerve block and how does it work?
Absolutely. So nerves are like wires that transmit information between your brain and all parts of your body. When you get a nerve block, an anesthesiologist uses a fine needle to place medication around the nerve that temporarily pauses that signal between the part of your body getting surgery and your brain. And this results in the sensation of numbness. For example, when you get a nerve block before surgery, when the surgery starts and the surgeon makes his incision, instead of your nerves doing their normal job of alerting your brain that you should be feeling pain, they're already numb and your body doesn't feel it, you just feel numbness.
Great, thank you, Dr. Behnam. A common follow-up question to that is, are there different kinds of nerve blocks? Yes, there are different kinds of nerve blocks. Depending on the surgery you're having, your anesthesiologist may tailor a specific nerve block for that area of your body that you're having an operation on. Patients can benefit from nerve blocks not only if they're getting operated on their arm or leg, but also there are nerve blocks for chest and abdominal surgery. As an example, if you are coming into the surgery center and having an operation done on your left ankle, your anesthesiologist may talk with you about a nerve block specifically for that ankle. They may use an ultrasound device, as seen here. The same thing we use to look at babies and pregnant patients, we can actually use that same device, scan that left leg, and find the specific nerves that supply sensation to your ankle, and that way we can target those nerves and numb up that ankle for you. In certain cases, your anesthesiologist may recommend a combination of techniques like Dr. Rambhia mentioned. We may do both a nerve block and general anesthesia. Okay, so Dr. Rambhia, can you tell us about the benefits of getting a nerve block?
Sure, thanks Dr. Chen. So what are the benefits of nerve blocks? Nerve blocks are targeted to your specific site of surgery and have actually been shown to be more beneficial in terms of pain control versus pain medicines that are typically injected into the vein or into the muscle. Patients who receive a nerve block tend to need less pain medicine both in the hospital or in the surgery center and at home. This is helpful because a lot of pain medications do come with side effects ranging from nausea to dizziness. Additionally, recovery can be faster with a nerve block. You're able to eat and drink faster, and you can also participate in physical therapy earlier, which is associated with better health outcomes and faster healing. And overall, you're able to go home a little bit earlier, typically if you have a nerve block and your pain is very well controlled. Another advantage of a nerve block is that in some cases, for certain procedures, it may actually help you avoid having a general anesthetic or general anesthesia. We talked about cases where you may receive both general anesthesia and regional anesthesia or nerve blocks, but in some cases, if we're able to adequately numb up your extremity, you may not need additional anesthesia and can avoid general anesthesia, which can be associated with other side effects, including nausea, vomiting, or temporary confusion.
Thank you for that great explanation, Dr. Rambhia.
Absolutely. As with any procedure, there are some risks associated with nerve blocks. Anytime your skin is broken, whether it is with placement of an IV or incision from surgery, there's a general risk of bleeding and infection. There are more serious risks, however, much more rare, such as injury to the nerves. When this does happen, it really rare. It becomes permanent. There are other when something like that is of concern, but when when a patient feels something unusual or unexpected after a nerve block, it's important to contact your anesthesiologist right away. Also, you may not be a good candidate for a nerve block if, for example, you're on blood thinning medication, if you have bleeding disorders, an infection at the site of where the nerve block would go, or if you have a pre-existing injury in the area where the nerve block would go.
I see.
Yeah.
And Dr. Behnam, you mentioned that there may be a risk of infection or bleeding with a nerve block. Are there ways that your anesthesiologist can try to minimize that risk?
Absolutely. So for the major risks mentioned, we mitigate them. So for things like bleeding and infection, we use a sterile cleaning solution, sterile gloves, sterile technique. And to minimize the risk of injury to things like nerves or other surrounding areas, we use ultrasound to more accurately visualize what we're doing, and it actually has significantly decreased these risks.
Great to know. Thank you, Dr. Behnam. Another thing patients often ask is, will I be awake during surgery if I'm getting a nerve block? For the most surgeries, after you receive a nerve block, your anesthesiologist will safely drift you off to sleep. For less invasive procedures, you may be sedated but still able to talk with the surgeon and anesthesiologist, but you'll be comfortable, numb, and relaxed. It's important to note that if you do receive a nerve block, afterwards in the recovery area and later on at home, the area of their body that has been blocked may still be numb and may feel heavy. Sometimes, if it's an arm or a leg, you may feel weak, which is normal because both the sensory and the strength, the motor nerves are blocked. So it's important to let your caregivers know that to make sure that you don't put pressure on that extremity, your arm or leg, if you're still feeling that numbness. That way you don't get any additional injury while you're recovering from your surgery. Okay, so Dr. Behnam, some folks also want to know, how long does a nerve block usually last?
Absolutely. So when a nerve block is placed before surgery, typically the nerve block lasts not just for the duration of the surgery, but for several hours afterwards. And depending on the local anesthetic of medication selected, it can even last as long as 24 hours afterwards. There may be some cases where the nerve block could last as long as a week or more, which is unusual, and is another case where you should contact your surgeon and anesthesiologist immediately for further guidance of how to be taken care of.
Okay, thank you. All right, so Dr. Rambhia, can you walk us through what to expect when a patient is getting a nerve block? How is it done in real life? Can you show us how we do that?
Sure. Actually, we would love to show you kind of in real time what to expect if you're going to receive a nerve block. So Dr. Behnam here will model for us, and we can walk you through a little bit of what it may look like.
Great.
Great. So the nerve block is usually done before going into the operating room or in the operating room before surgery. Your anesthesiologist will guide you through the process and will typically give you a mild sedative to help with any nerves or anxiety that may be present before the procedure begins. Before we get started, a safety check will be performed with all of the team members in the room. So typically, the anesthesiologist will start by placing a hair-thin needle just under the skin to numb up the skin before the needle for the nerve block is placed. So we kind of let the numbing medicine settle in and wait before we perform the nerve block. This is usually the most uncomfortable part of the procedure. Next, you will feel some cold gel, and we will place the ultrasound probe on the area that we are looking for to identify specific nerves in that area. Excuse me, Dr. Behnam, here we go. Okay, great. So you'll feel a little cold jelly, and then the anesthesiologist will actually be using the ultrasound in real time to guide their needle to identify the nerves themselves and any important structures around the nerves, and place the numbing medicine or local anesthetic very carefully around the nerves so that it can bathe the nerves and help numb them up. Great. Thank you. A nerve block typically takes less than 10 minutes to perform and up to 30 minutes to take full effect. The nerve block injection itself, as I mentioned, should cause minimal pain, and again, the most uncomfortable part is typically the initial numbing medicine that is placed to help numb the skin before the procedure begins.
Great, thank you, Dr. Rambhia. And thank you, Dr. Behnam, for being an outstanding model. After the nerve block, as mentioned before, that part of your body that has been numbed and will be operated on will be numb for several hours even after surgery is complete. You may be unable to move that part of the body, which is expected because it blocks both the sensory and motor nerves. When you are at home, once the nerve block starts to wear off, there'll be a transition period where that numbness sensation may change to tingling. Then you may start to feel some of the pain associated with surgery, which is normal and expected. Your surgeon or surgery team will have prescribed pain medicines to take by mouth in order to alleviate the pain once the nerve block wears off. And you'll be typically sent home with those medications right after your surgery. Thank you folks for tuning in to our Facebook Live, and hope you guys have a great rest of your evening.